For many people, traditional antidepressants and standard talk therapy are effective tools for managing depression, but they don't work for everyone. When multiple standard treatments fail to provide relief, it leads to what clinicians call treatment-resistant depression. For patients, it often feels like being completely frozen, neurologically and emotionally stuck in a state of exhaustion. The traditional psychiatric approach often tackles this by treating patients in silos. You try one medication, maybe see a brief bump in progress, and then flatline. So you try another isolated therapy, hoping for a different result. Adelaide Street Consulting Rooms operates on a different principle. Complex mental health conditions require an integrated program where every intervention is intentionally coordinated. To finally break the cycle of treatment-resistant depression, we have to abandon the standard menu of standalone treatments and build a cohesive, connected ecosystem of care. This is the foundation of TMS Plus, a coordinated ecosystem that brings multiple evidence-based interventions together into a single, personalized program. The first pillar of this ecosystem is precision-guided neuromodulation. Using MRI-guided transcranial magnetic stimulation, or TMS, we can physically target the specific brain circuits associated with depression and anxiety. The second pillar focuses on behavior. Personalized Immersive Therapeutics, or AI-PEAT, uses behavioral activation and immersive programs to help patients rebuild positive emotional engagement and shape their own recovery narratives. The third pillar holds it all together: data-informed coordinated care. Every step of the patient's journey is guided by multidisciplinary psychiatric review and rigorous measurement-based monitoring. This ecosystem provides the foundation for recovery. Though for severe, entrenched depression, we often introduce a biological catalyst to initiate the brain's response. TMS Plus Ketamine is an advanced pharmacological tier incorporated selectively into the broader ecosystem. It is never offered as a standalone service. To understand why it's used, we have to look at the biology. Unlike traditional antidepressants that operate on the slower monoamine system, ketamine is an NMDA receptor antagonist. It creates a rapid surge in glutamate signaling. That powerful glutamate surge triggers a state of neuroplasticity, the brain's ability to adapt, learn, and rapidly form new neural connections. For a patient, this doesn't act as a cure-all for sadness. Instead, it creates emotional flexibility, helping patients feel less stuck and more capable of engaging with their own recovery. Ketamine provides a critical, temporary window where the deeply entrenched patterns of severe depression can actually be rewritten. Curious, which brings us to the central clinical question: how do we take advantage of that temporary window of neuroplasticity to create permanent recovery? The answer lies in biological synergy. Ketamine acts as the primer, creating a fertile state of brain plasticity. While in this state, MRI-guided TMS simultaneously steps in to physically stimulate the exact neural circuits associated with depression. Finally, AI-PIT interventions actively reinforce adaptive emotional and cognitive patterns, cementing those new connections while the brain is most receptive to learning. Unsticking the brain, targeting the circuits, and reinforcing the behavior. This precise coordination is what allows the TMS Plus ecosystem to succeed where isolated treatments so often fail. Because ketamine is such a powerful biological tool, it requires uncompromising safety and monitoring standards. It is not suitable for everyone. This flowchart outlines the KSET framework. We use it to rigorously monitor patients before, during, and after every dose. As seen below, these protocols mandate continuous cardiovascular monitoring at strict intervals, alongside comprehensive orientation testing and rigid discharge criteria. Every single recommendation to include ketamine is made only after a thorough psychiatric assessment and shared decision-making with the patient. By relying on measurement-based care, we transform ketamine from an unpredictable variable into a highly precise, safely managed clinical tool. Because every patient's clinical data is unique, the introduction of ketamine is highly modular. It is selectively timed based on real-world response. For some, ketamine might be introduced before a TMS course to improve engagement. For others, it operates as an additional layer during the program, or even afterward to consolidate treatment gains. The clinical focus remains on how this advanced pharmacological tool serves the broader recovery pathway. By combining precision neuromodulation along with immersive therapeutics and data-driven pharmacology, the ultimate goal is clear: to maximize the patient's opportunities for functional improvement true resilience and long-term well-being.